You don't have to wait for your biological clock. There are techniques today which are available, which is called as egg freezing or oocyte cryopreservation. It's called AMH, anti-Mullerian hormone, which assesses your ovarian reserve. By that I mean we know how long your eggs are going to last.
It's so nice to have you here with us today, and as discussed, we are going to talk about egg freezing options for young women, and not only for medical reasons but also for social reasons, and just to send out the message that reproductive capacity of a woman doesn't really depend on a marital relationship. One has the option of freezing an egg and choosing to have a baby when one is ready for it. So there are some common questions regarding egg freezing, Dr. Malpani. And first, I would like you to explain it in a layman's terms, what egg freezing is, and then we'll take it from there.
Okay. So basically, egg freezing is a procedure which is done to preserve a woman's eggs. It simply means that it's a procedure whereby you can postpone your pregnancy to a later date, whether it's for a medical reason or for a social reason. So today you can almost say biology is not destiny. You don't have to wait for your biological clock. There are techniques today which are available, which is called as egg freezing or oocyte cryopreservation. And we can use this technology to help us in having a baby at a later stage.
Okay, in short, can you describe what the technology entails?
Okay. So egg freezing is basically a technique whereby you harvest the woman's eggs. So it's a lot like an IVF procedure, the initial part. It's just that we take the eggs and then we freeze them in our laboratory. So I'll just run through the steps of the egg freezing. What it entails is from day 1 of the menstrual cycle or day 2, the woman needs to take hormonal injections or gonadotrophic injections every day for about 9 to 12 days. In that meantime, the doctor will monitor the growth of the eggs, or they're called follicles on sonography. We'll see the number and the size of the follicles. And once they are ready, we give a trigger injection of HCG to mature the eggs. And 36 hours after this trigger injection, we take the woman into the operation theater under anesthesia. Using a vaginal ultrasound, we take the eggs out with a needle. So there is no cut. It's not an major operation. It's a procedure where the needle goes into the vagina and the eggs are then taken out of the ovary. These eggs are taken into the laboratory where they're checked for maturity and they're graded. The eggs which are of good grades are all frozen in liquid nitrogen, which is at minus 196 degrees centigrade, and they're kept in the cryo can. Now, this is a beauty because these eggs can be frozen forever. It's like they are sleeping, or it's something like Kumbhakarna slept for 100 years, and then he woke up fresh. Same way, we can keep these eggs as long as you want. And when we thaw these eggs out, they are as good as fresh eggs. So I think that's a very important thing.
So you're saying that the eggs are good to last forever?
Yes, yes, yes. So today you don't have to say they can last for 5 years. They do not get spoiled. If I take them out of 15 years also, they're as good as they were 15 years ago. So that is the beauty of this technique. And today this technology has changed. It's called flash freezing, or where the freezing technique is very fast. It's called cryopreservation, which is different from the past. In the past, a lot of eggs were getting damaged during the process because of formation of ice crystals in them. But today, we get 100% recovery in my clinic. So if you take out 10 eggs are frozen, when we thaw them, all 10 eggs survive. So it's 100% recovery. So it's important to choose a good clinic and a good doctor too.
Okay, so what are the 5 things you would say that women need to do? Suppose I want to do freeze my eggs today. So what are the 5 things that a woman needs to do? What is the prep process? Can you take us through that in simple steps so that everybody understands?
Okay. So now the 5 steps to remember, I mean, 5 things I would want to tell you to remember is a woman's fertility starts declining at the age of 30, as early as 30. A lot of women don't know that. So they wait till 35 or they wait for menopause or they wait, oh my God, at 40, I can do it. No, every woman's fertility starts declining as early as late 20s, you can say, or even 30s, and rapidly declines up to the age of 35. So if a woman desires a baby, it is best to have a baby in your late 20s or early 30s, because that's when the eggs are of a good quality and you can have a baby easily on your own. Remember, even with IVF, it's more difficult to get pregnant once you're past the age of 38, 35, simply because the egg quality deteriorates. So please remember that. So that's point number 1. If you ever want a baby, please try between if not in late 20s, at least early 30s is a good time. Secondly, if you do want a baby or you want to postpone your childbearing for whatever reasons, it could be social reasons these days are you don't want a baby because of your careers, you don't want a baby to pursue education, or you just want to have a good time, or you just, like you're not ready to have a baby, then at least think. What one needs to do is a simple blood test, which is known as AMH, anti-Mullerian hormone, which gives you full information about your ovarian reserve. By that, I mean, we know how long, your eggs are going to last. It's a rough idea, but it's a marker which tells you. So a normal test is between 4 and 6 nanograms per ml. So let's say if your testing comes as, say, 1.5, then you know that you don't have much time and you need to get pregnant as early as possible.
Or harvest the eggs.
Want to get pregnant,
or if you don't want to get pregnant, then you have to harvest the eggs.
Yes. So if you don't want it, then at least, do your egg freezing and keep it, because that's like an insurance. And like I said, the eggs last forever. So you can take your time whenever you want to. So that is very important. And then when you do come for egg freezing, I think the basics, I mean, the third point is you have to eat well, stay healthy. You need to exercise, yoga, meditation, everything helps for physical, mental. You have to be stress-free. Well, it's not something different that I'm saying. It is even when you plan a natural pregnancy, you follow the same steps. And basically, you have to be healthy to do the egg freezing, and you can do it at any time. So egg freezing is a very simple procedure today. It's become quite common. It's available. But please look for a good doctor, a good embryologist, and a good laboratory. A lot of clinics these days claim to do IVF. They don't even have an embryologist full-time. They don't have a facility. So please check that, because your eggs are precious. If they're not frozen, you don't want to go after 10 years and then the doctor tells you, oh, none of them have survived. So I think that is very important, because if you're going to keep them for 10 years, you might as well choose a good laboratory and a good doctor. So that is very important. So do your homework. What I'm trying to tell you is, please educate yourself. You cannot afford to say, oh, doctor ne freeze kiya, doctor ne bola, because you've lost those 10 years of your life. So please educate yourself about IVF, about egg freezing. There are good sites. Look for a good doctor, ask a lot of questions, and do that. Do your homework and go. So I think patient education is very important again. Number 3. Number 4 is, of course, you need to eat healthy, like I said, do your homework. And then when you go back and again, go back to the same doctor and ask what has happened, what is the possibility, when can I come in, do the routine checkup, of course, and then you can go ahead. So basically, that's it. So you need to know.
What about supplements? Does the young woman need to prepare herself before the harvesting with some supplements before she decides that she has to go for egg freezing?
Yes.
Is there a warm-up period?
I've lost you, Rinku. I can't hear you.
What does a young woman need to do? Say, is there a warm-up period for her to prepare for the egg harvest? Does she need to take some supplements? You talked about a healthy lifestyle, but does she need to take supplements? Like folic acid, for example.
So there's not much of preparation. There is very little preparation. So if you're leading a healthy lifestyle, or if you're exercising, that's great. But a few things, just like in a natural pregnancy, you have to stop smoking. If you're a heavy smoker, you need to go off alcohol.
How early? Before
2
the
months
PCR.
before, at least 2 to 3 months before trying.
Okay. Okay.
So
And
if you want to have your eggs transferred, let's say in December, then at least you can start that from August, September.
okay.
So 2 to 3 months before you go off alcohol, you stop smoking, and you need to take what is called folic acid, 5 milligram per day, to avoid abnormalities in the child. I think that's the only requirement which is important.
Okay. So suppose somebody has gotten her eggs frozen at say age 28 and chooses to have a baby at 45 and get pregnant at 45. What are the chances of that baby being born normal without the risk of a congenital birth defect?
It's a good question because there are no risks. That I would say not zero risks, but very, very minimal risks, because you have frozen the eggs at 28. So basically the eggs are young. The woman is old. Now the uterus does not get old. So as long as your uterus is healthy and your eggs are already healthy because you've frozen them at the age of 28, the chances of abnormalities are very, very low compared to if you had conceived at the age of 45. There's a huge difference in the two. So I think that's a safe bet to get pregnant at 45, provided you are healthy. So your blood pressure is normal, your blood sugar is normal. Overall, you have a healthy lifestyle. And you have to check your uterus lining. That's all you have to do. The uterus can hold the baby. I think it's a very important thing to remember that as you grow old, your uterus does not get old. It's only the ovaries and the eggs that age. And this is a very, very common misconception. So there's no need for a surrogacy. All you need is either to freeze your eggs and keep. And if you're old and you want a baby, then what you need is an egg donor. I think that's an important thing to remember. As long as your eggs are fine, you have a good chance of getting pregnant and you have a chance of a healthy baby.
So egg freezing is also a good option, would you say, for women suffering from PCOS and PCOD?
No, because PCOS, usually people have a lot of eggs. There is no problem in most PCO patients. Of course, the ovulation, there is a problem with ovulation. There is a hormonal problem, but it's a very easy problem to solve. If you go to a good infertility specialist or a good doctor, they will usually adjust yours so that you get regular periods if you don't want a baby. And if you want a baby, then giving the same gonadotrophins, you can ovulate, get a lot of eggs. In fact, I love PCO patients for the simple reason that they grow a lot of eggs.
Okay.
And we are greedy. We want lots of eggs to freeze for the future. So when a PCO patient comes, it is tough. It is tough to monitor when you're taking those gonadotrophins, because sometimes PCOs don't grow and you give them sometimes a small amount of injection and they grow a large number suddenly. So yes, the follicle monitoring is difficult, but if you're an expert or if you're used to doing it, it's no big deal. In fact, like I said, PCOs are the best patients because they grow a lot of eggs and they grow a lot of, once you have frozen a lot of eggs, then your chances are even higher. Or if you're doing an IVF, you grow a lot of eggs, you grow more embryos, and then we can sit and transfer one embryo and they usually get pregnant at some point. So PCOS is not a reason to freeze your eggs. But yes, there's something else which is called as endometriosis or a poor ovarian response. So let's say you've done your AMH and your AMH testing has come less than 2 or less than 1, let's say. Then you need to hurry up, go freeze your eggs. And sometimes you get just 4 or 5 eggs in one cycle instead of the normal, which are 10 or 15. Then you need to do what is called as egg pooling. So you need to do more cycles, maybe 2 cycles, maybe 3 cycles, till you get a fair amount of eggs, which is 10, 15, and keep them. So that is important, because if you wait 5 or 10 years, you may find that you land up with 0 eggs at the age of 35. Exactly. Those are the poor responders. Even in endometriosis, the poor quality of eggs, the number of eggs goes down. So you need to do these, sometimes we need to do for medical reasons.
So thank you, Dr. Malpani, for sharing these insights, where women have a great option of freezing their future and be happy with it without any social pressures on them. Thank you so much for joining this session.
Yes, thank you very much.